Good afternoon, students. I am Dr. Onimesh De from Allied Health Science Department. I will give a series of lecture videos on microbiology and pathology paper. I have already discussed in your class about the special pathology topics, which are respiratory disorders and cardiovascular disorders. In the upcoming videos, I will discuss about the GI pathology. In this video, I will give a small introductory part of peptic ulcer. You have already learned about the GI physiology. The histological structure of GI system consists of four layers. The innermost layer is called mucosa. After mucosa, there is a presence of submucosal layer, which is shown in the white surface. Then muscular layer, and the outermost layer is called serosa. Mucous layer is the most important layer because the food substances is continuously passed through this layer. Therefore, there is a direct connection between food particles and mucus layer. In the peptic ulcer, the main problem is arised within the stomach or gastric surface. The stomach is divided into several parts, which is a comma-shaped structure and consists of an extra coat of muscle layer within the mucous surface. And this layer is called muscularis mucosa. A number of invaginations are present within this muscularis mucosa layer. The stomach structure has two gateways. At the esophageal end, the gate is called cardiac end, and at the small intestinal surface or duodenal surface, the end is called pylorus. There are presence of two important structures for the continuous movement of foods within this stomach surface, which is called sphincter. There is a presence of two sphincters, cardiac sphincter at the cardiac end and pyloric sphincter at the pyloric end. The main problem for peptic ulcer is formed due to continuous structural destruction of muscularis mucosa layer. We will describe the basic concepts of peptic ulcer, comparison between duodenal and gastric ulcer, which is very much important for your syllabus, etiology or causes, clinical presentation, management, and emergency scenario, etc. The last two topics are not included in your syllabus. What is peptic ulcer? Peptic ulcer is the destruction of mucosal layer which is already discussed in the last slide. This mucus layer consists of a extra muscle coat. Due to any reason, if there is a destruction of this mucus layer within the GI inner surface of the GI tract, it can cause ulceration. What is ulceration? Ulceration is a necrotic event, a necrotic situation due to lysis of tissue or cellular patterns. Therefore, a break in superficial epithelial cells penetrating down to the muscularis mucosa confirm peptic ulcer. Actually, we describe peptic ulcer in a broader way. Peptic ulcer is divided into two types: gastric ulcer and duodenal ulcer. Gastric ulcer is the actual area of stomach problem, whereas duodenal ulcer is problem within the duodenum region. You know that our stomach is very much acidic in nature. Why? Because within the stomach there is a secretion of HCl or gastric acid, and the pH value is approximately 1 to 2. This is highly acidic environment. Although due to presence of thick muscularis mucosa, this acidic environment is neutralized. But any problem, any damage within this muscularis mucosa can cause a serious problem or bleeding. This problem is more often seen in the duodenal part rather than gastric part. Therefore, gastric ulcer is not so prominent than duodenal ulcer. This is the difference between duodenal and gastric ulcer. The incident rate of duodenal ulcer is more common than gastric ulcer. Why? I have already mentioned the environmental situation of gastric area and duodenal area. Duodenal area is not so much acidic than gastric area because here the main substances which are involved in the digestion are pancreatic juice and intestinal juice, which are both basic in nature, whereas gastric juice is acidic in nature. Due to destruction of duodenal surface, the acidic food is directly exposed within the duodenal region and which can cause hamper or damage more efficiently. Duodenal ulceration occurs at the first part of the duodenum or at very much close to the pyloric end, whereas gastric ulceration is developed at the laser curvature of the stomach. Here, we can easily observe the area of gastric and duodenal ulceration. Duodenal ulceration is observed or can be formed within this region just following the pyloric end, whereas gastric ulcer is developed within this region, laser curved region, laser curvature, not at the greater curvature, at this region, because the acidic environment is very high in this area. Third point, duration. Duodenal ulcer is acute or chronic in nature, whereas gastric ulcer is chronic or long duration problem. From the duodenal ulceration, malignancy or rate of malignancy development is rare. But in case of gastric ulceration, maybe gastric cancer or gastric tumor can be developed. In the next video, I will describe about the pathophysiology and etiology of gastric ulceration. And another important part, symptoms, diagnosis, will be described later. Please follow my channel for detailed description of the special pathology syllabus. Thank you.